Did you ever have backache and you also have diabetes mellitus? Then you need to know there is a connection between diabetes mellitus and backache. Almost 60% of the adult population of the world do suffer from backache somewhere in their life, and many of them are diabetic. And if you are a diabetic, there is almost double the risk of having a backache. Now, in the first part of the video, we'll focus on the reasons, and then we'll discuss what to do and not to do, and in the final part, we'll discuss how to treat it without medicine. So, let's come to the first part. What's the reason of backache in diabetes mellitus? The first thing is, as we already know and we have discussed in the previous videos too, the rise in glucose level leads to formation of certain products like advanced glycosylation end products, polyol pathway, and there's so many products are there which are toxic to the layers of the myelin or the layers of the nerve. So just like the rubber coating of an electrical wire, if the rubber coating is gone, the wire tends to expose itself to the outside environment, it tends to short circuits, it tends to produce spark, it doesn't function properly, and that leads to a false signal of pain to the brain. That leads to a continuous pain and a feeling that is not really diagnosed on the basis of local information, because the X-ray generally shows there is nothing much, but the patient is having a persistent pain that's not going away. Along with that, one possibility is that the arteries are also not providing enough nutrients to the muscles of the back. So this happens in diabetes. This is called the peripheral arterial disease, in which the arteries tend to go into inflammation. There is a narrowing of the arteries and the supply of the blood is relatively less as compared to healthy arteries. This leads to less supply of the blood, which means less supply of the nutrients, less supply of oxygen. So there is an ischemic kind of pain. So that's also possible in few instances if the blood sugar is not controlled. Along with that, obesity is one of the major causes of type 2 diabetes mellitus, and obesity on the other hand is one of the causes of low back pain. The reason for that is if you have a big tummy, you are essentially having 10 to 15 kg of weight that is pulling your spine to the front side, and that is causing your posture to be malaligned, and this continuous stress will ultimately lead to low back pain. The fourth thing is there is a subtle degree of inflammation going on all through the body if you are a diabetic. And that holds true even in the feet. If the inflammation of the feet is just too much, it tends to formation of Charcot joints, in which there is a total flat foot, and it's an acquired flat foot that happens to adults with type 2 diabetes mellitus or even type 1 sometimes. So likewise, the inflammation of the joints of the spine can lead to pain. So most of the times these things are relatively ignored when the back pain is being assessed or we are thinking about the different causes of back pain. Diabetes can be a contributory cause. So what to do in that case? The do's and don'ts are, please control your blood sugar level, take whole meat, take more of vegetables, less of sugary drinks, and do some exercise. What kind of exercise? I'm going to discuss that in the next part of my video. But generally, use intermittent sitting. If the sitting is causing too much pain, there should be a specified amount for which you sit, and then you must get up. You don't wait for your back to hurt. Just like I'm sitting right now, I am having straight shoulders along with straightening of my spine. There is a slight bump in the lower part of my back that is supporting my lumbar spine. So this is the right way to sit. If I am slouching forward, and if I'm doing it for the longer period of time, like for example, most of us are working on the computers for like 8 to 10 hours. In that case, our spine has to take care of the slouching shoulders, and that is a huge strain for a longer period of time, and that is also a reason for pain. So let's move to the next part. What to do now? We are having pain and we have come to the conclusion that the diabetes may be contributing. We have taken care of the diabetic control. We are taking the good diet. We are not taking too sugary drinks. The exercise should be focused to your spine, and for that yoga is the best exercise, and for that a yoga type, specific type of yoga called Namaskar yoga. It is wonderful for the low back spine. There are so many other exercises you can do that. Even your physiotherapist, if he or she is recommending you some kind of exercise, you must do that. Along with that, there is a thing called acupuncture. Generally, I'm not in favor of any needling of the body, but there are certain things called massages, the roller massage, and the things like that. You can do that if they work for you. There is a thing called posture corrector. If you tend to slouch forward and your shoulders are slooped in front towards the front side, in that case, please use a posture corrector. Posture corrector will keep your shoulders at the normal posture, and if you forget and you tend to slouch forward, you will feel like you are wearing something below your shirt, and that will help you to maintain your posture. And after a specific time, you tend to remember the actual posture, and you don't need to wear the posture corrector for the rest of your life, and it's not too costly too. Along with that, I think there is another exercise called Tai Chi or Qigong. Now, these exercises are not really mainstream, and they are not really talked about, but there is some data that if you use them properly, these are kind of martial art exercises that will help you to control the low back pain. Now, the hot and the cold therapy, both of them work. The cold pads and the hot pads, that can be used and they relieve pain. Some people tend to focus on the nutritional element of treatment. For that, I would request that we should focus on a couple of things. The magnesium supplementation in any kind of muscular pain is relatively essential, and there is some data that if you take sufficient magnesium rich food, that tend to control the muscle aches and the back aches to some extent. And for magnesium rich food, we are talking about almonds, and we are talking about avocado, and to some extent spinach too. Ayurveda, they talk about turmeric with some degree of ginger, and turmeric and ginger is a nice combination because they have a lot of anti-inflammatory effect individually, and when you combine them together, they do work well. But the scientific support of using it is not really robust, but there is some advocacy by the Ayurvedic culture that they tend to work, and they do work in most of the pains. But too much of everything is not good. You should be discussing with your physician whatever you are going to use, and if your physician is not in favor of using it, probably you should not be using. So stay healthy, stay strong, and stay informed. Thank you so much for tuning in.